abnormal. So an entry-level content based on the pathophysiology will give you the idea to be sharp. And that is my method of prioritization. Prioritization, this is how you approach prioritization question. Is B sharp? The B is a breathing problem. These are the things that always cause patient morbidity. There's so many things that cause them, but these are the ones if you don't do anything, they're going to have problems. So I put them together in the form that you said these are the conditions that I need to worry about. Look at them the second time. So breathing, yeah, the breathing. So there's certain things that cause breathing. So anything that affects the lung itself. And as you can see, I draw it like that. Lung, like if you have pulmonary embolism or if you have pulmonary edema, all this thing can cause problem. Okay, if you have a pneumothorax, it can cause the lung not to breathe well. And that is something that you have to worry about. Even if you have a DVT turns into PE, and then that also causes a breathing problem. So there's few things that are over there that you should be worrying about. Then the E is the electrolyte. So few electrolytes that you control your body homeostasis. So your calcium, your magnesium, potassium, and sodium. When these levels are low and high, you should be very careful that they're going to cause a problem. And so when you see those answer choice, look at it twice. I give you a calcium of 17. That's really, really high. Calcium of 6. That's really, really low. And the patient will tell you, I'm not feeling well through their physical exams. That's all what this is being sharp is about. And the S is sepsis, okay? Sepsis and shock. They look alike. Basically, sepsis is infection, but it's a severe form of infection. Patient temperature can be low or high. And then they may have blood pressure will be down. So hypotensive and tachycardia. Those are the key words you're looking for. They give you a temperature, they give you blood pressure low, and then heart rate high. You should be thinking about sepsis. Or somebody just had surgery and the wound doesn't look fine. That is sepsis. You got to intervene. And then the S, which is the shock. Shock is the same thing. They have blood pressure problem, very low, heart rate high, and their mental status will change because it's hypoperfusion problem. They are not getting blood into their brain. So, and the thinking is affected. The whole body system is affected. So it's a bleeding problem. They're bleeding, which is shock. Any person that they give you a question that is bleeding, you should be worrying about. Then this one is hypothermia. That's the H. Okay. So we're talking about temperature that is low, like 97, 96, 96, okay, Fahrenheit. That one is not good because hypothermia is usually, I consider that as a cardiac problem. So 96, you get cardiac arrhythmia. Okay, so those things are not normal. Okay, that those things are not normal. So you should be thinking about it. And hypoglycemia, they like tricking you with this. They will give you a sugar of 500. Don't worry about it. Sugar 300. I'm not worrying about it. Unless your sugar is less than 70, I'm not worrying about you because when your sugar is low in the 60s, your brain function cannot work. The whole body system is affected. You become lethargic, you become confused, and your whole body basically in a hyperdynamic state in order to get all the energy that they need. So that's what you're looking. You're just being sharp as an entry level nurse. And then this, you see, it doesn't have the lung there. This is your number one, and that is the airway. Anything that is affecting this pipe, you have to be sharp about it. So if the patient has a stridor, yes. If they're drooling, yes. You see, If there's like tracheal deviation, anything they give you, there's a bronchial something, they mention bronchioles, they mention trachea, they mention larynx. I mean, you just basically trying to be supraglottic, something, whatever they say that is associated with this tube, I have to pick it as my number one, no matter what, because it's the tube that is bringing oxygen into the lung. So you have to pay attention, and that is number one. And of course, the R is lethargy. That's a neurological problem. So when you're lethargic, your brain doesn't function well. And when your brain doesn't function well, it affects your breathing system because that's where your breathing is located. It can also affect your circulatory system. So this is why a neurologic problem is very important. So they become lethargic. They will have acute mental state change. So anybody in your test that they give you and is confused, you have to worry about it. Confusion is always a problem. You got to figure out why they're confusing. Is it because they have electrolyte problem or they have neurological problem? So you got to figure out. Any patient who had a seizure, yes, is a problem that I should worry about because of the airway issue. And even they can give you restlessness in over here in airway. I forget about it. Restless. You cannot take this as anxiety. They give you restless. It's either they have an airway issue or some form of breathing issue, but mostly airway. And you should consider it as very, very serious problem. Okay. So that's all the information you need to know about being lethargic. When they give you a patient who's lethargic, you just have acute mental status change, just had a seizure, look at them twice. And my favorite is pain. Okay, we all have pain, and pain is always a trick thing they give you in your exams. Every patient that come in may have a sort of pain, but you have to figure out which pain you have to be sharp about. Which pain, as an entry level nurse, can you weed out? And you said, no, this is the one I need to be sharp, extra careful. And the way to know about it is the pain that is going to affect the individual life, their lung, and their eyesight. So if you have a pain in your eyes, and I know this kind of pain can make you lose your eyes, I'm choosing you as a priority action. If you have a pain in your leg, and I know you can lose your leg, I'm choosing you. If you have a pain that I know if I don't do anything about it, you're going to die or you're going to lose an organ, I'm choosing you. And that is the pain for that will cause you to lose your limb, life, and the eyesight. And that is the key. That means you're critically thinking, you're using yourself as an entry-level nurse, and you are being sharp. You see how it's connected? This is the critical thinking right here. That I'm being sharp, I'm critically thinking, and as an entry-level nurse, I'm prioritizing adequately using this technique. And as you can see, these are a bunch of words put together with disease process that is very common. It has very high morbidity, high mortality, and I have to be extra careful. It's a toolbox, basically, that you carry with you, like your Bible, and you take it with you and say, this verse, I've seen it before. I've seen DVT is a breathing problem, and I need to apply it to be able to take care of my patient. You are just being extra careful. You are just being focused. Remember, every patient is a priority. If they give you 4 patients, all of them is a priority. That is why they came to the emergency room. They came there because they have a problem. To them, they have a priority problem. But you, as an entry-level nurse, is to be sharp and see which one I need to take care of first. All they asking you, take care of one patient at a time. But who do you want to choose? 4 patients, who do you think deserve the first position? How do you do that as an entry-level nurse? Is to be sharp And being sharp is take care of the breathing issue, take care of electrolyte issue, take care of sepsis and shock, take care of hypothermia, hypoglycemia, take care of the airway, take care of a neurological problem, and take care of pain. But how do you do that? Classify them here. You may get airway, lethargy, pain, and sepsis patient, but then you got to go to the second level of thinking. That is where the advanced level come in. But as you know, based on the disease process, you know which one can kill the patient first. If I have an airway issue, neurological issue, and a pain issue and a shock, I'm choosing an airway. If there's no oxygen coming in, you're dead. I can give somebody blood to help with the shock, or sepsis, give them antibiotic, pain, take care of the pain. But this one, I don't have time, minimum time. Do you have time to do something else? Yes. And therefore, that's why I would choose this. If I have a breathing issue and a circulatory and a shock, I'm choosing a breathing issue because it's still the lung. I know we always say ABC, I hate ABCD, whatever it is, because it does not let you be sharp. It doesn't let you think. We want you to think as an entry level nurse so that you can prioritize. So this is the key for entry level nurse who is trying to take your NCLEX.